Hello dear viewers, I hope you all my viewers will be fine and enjoying my videos. Dear friends, dear viewers, welcome to my YouTube channel Vlogs Media. I hope you will like my video. I hope you have to subscribe my YouTube channel. If you have not yet subscribed to my YouTube channel, then I kindly request you to please subscribe to my YouTube channel and press the bell icon to receive notification of my upcoming videos. Dear friends, dear viewers, in this lecture video I will go and discuss the enteral and parenteral nutrition. But so basically enteral nutrition, it is also known as tube feeding, a way of delivering nutrition directly to your stomach or small intestine, while parenteral nutrition, it is the intravenous administration of nutrition which may include protein, carbohydrate, fat, minerals for patients who cannot eat or absorb enough food through tube feeding or by mouth to maintain good nutrition status. So these two are the roots of nutrition. Infant formula, baby formula or infant formula, or just formula or baby milk, infant milk, false milk or first milk is a manufactured food designed and marketed for feeding to babies and infant under 12 months of age, usually prepare for bottle feeding or cup feeding from powder or liquid. Indication for tube feeding: severe protein energy undernutrition, coma or depressed sensorium, prolonged anorexia, liver failure, inability to take oral feedings, critical illness like burns. According to the American College of Gastroenterology, there are 6 main types of tube feedings. These tubes may have further subtypes depending on exactly where they end in the stomach or intestine. Main types of enteral tubes: nasogastric tube (NGT) starts in the nose and ends in the stomach. Orogastric tube (OGT) starts in the mouth and ends in the stomach. Nasoenteric tube start in the nose and ends in the intestine. Subtypes include nasojejunal and nasoduodenal tubes. Oroenteric tubes starts in the mouth and ends in the intestine. Gastrostomy tube is placed through the skin of the abdomen straight to the stomach. Subtypes include PEG, PRG, and button tubes. Jejunostomy tube is placed through the skin of the abdomen straight into the intestine. Subtype including PEG and PRG tubes. Classification of enteral formula. So it starts from the standard to elemental, then disease specific and blenderized and modular. Standard first enteral formula in the first term is the standard. So formula containing intact nutrition, protein, fat and carbohydrate, which require normal or near normal digestive and absorptive capacity and or complete with respect to vitamin, minerals and trace elements at specified volume, contain 1 to 1.2 kilocalorie per ml and are used as over-the-counter oral supplement and tube feeding formula. Protein content 30 to 40 gram per liter. Calorie dense standard formula are often concentrated to provide 1.5 to 2 kilocalorie per ml when fluid restriction is required for patient. Nestle Nutrin tube feeding formula 500 calories. This formula provides complete calorically dense liquid nutrition for those elevated caloric requirements or a fluid restriction. Nutrient 2.0 contains taurine, carnitine and ultra trace mineral for long-term feeding. Elemental and semi-elemental contain partially or completely hydrolyzed nutrient. Formula have been hydrolyzed to contain short chain carbohydrates or simple sugar and peptides or amino acids. Elemental formulas are easier for the digestive system to digest and absorb, making them better suited for adults and children's with digestive problems, including malabsorption, short bowel syndrome, inflammatory bowel disease, and other conditions that can cause problem with absorbing nutritions. A disease specific is basically designed for patients with specific disease states, available for patients with respiratory disease, diabetes, renal failure, hepatic failure, and immune compromise. While blenderized feeding is used for patients that cannot tolerate semi-synthetic formulas or who wish to consume family food. Formulas with a mixture of blenderized food source. They are made from real food ingredients such as chicken, vegetables, and fruits, along with added vitamins, minerals, fibers, and other nutrients. Maintenance of aseptic technique is essential to prevent bacterial contaminations. Example are complete pediatric and reduced calories. So, modular formula are modular provides protein, fat or carbohydrates as single nutrients or modular mixtures to allow adjustment of macronutrient mix created from individual macronutrient preparation called modules are prepared for patients who require specific nutrient combination to treat their illness. Complication of enteral nutrition. Food entering the lungs is the first complication of the enteral nutrition. Constipation is another complication of enteral nutrition. Diarrhea is another complication of the enteral nutrition. Improper absorption of nutrients, nausea and vomiting, dehydration, electrolyte abnormalities, high blood sugar, vitamins and minerals deficiency. Feeding tube inserted through the nose such as nasogastric or nasoenteric tubes can cause irritation of the nose and throat, acute sinus infection, ulceration of larynx and esophagus. Feeding tube inserted through the skin of the abdominal wall such as gastrostomy or jejunostomy tubes can become closed or displaced and wound infection can occur. Complication with tube enterostomies, skin irritation caused by leakage of digestive fluid onto the skin around the stoma. Irritation is the most common complication of ileostomies. Diarrhea, the development of abscesses, inflammation of the ileum, and intestinal obstruction. Risk factors for aspiration include decreased level of consciousness, diminished gag reflex, neurologic injury, cardiac sphincter incompetency, GI reflux, supine position and tube malpositions. So this is all about our today lecture. I hope you will like my video. I hope you will understand my video. If you are new on my YouTube channel Vlogs Media, or you have not yet subscribed to my YouTube channel Vlogs Media, then I kindly request you to please subscribe to my YouTube channel Vlogs Media and press the bell icon to receive the upcoming notification of my upcoming lecture videos. Thank you so much for watching my video. Goodbye. Take care of yourself.